Here is your question.
Okay, ma'am.
All right.
I can.
So if you have read and understood, considering it
Yeah.
procedural skill station, kindly please continue.
Okay. I'm wash my hands. I'm one of the exam candidates. May I confirm your name and age, please?
Yes, Tina, 23 years old.
Nice to meet you, Tina. Uh, Today I have been asked to remove the skin lesion present over your arm or thighs, wherever, and
Okay.
this procedure would be under the local anesthesia. That is a
Okay.
numbing agent. So, are you okay with this?
Yes.
Okay, I will explain the patient. This whole procedure is going to be under the local anesthesia. It's a numbing agent, and during the procedure you won't feel any pain.
All right.
Uh, but it will be slightly uncomfortable for you. And uh, then I will ask for the WHO surgical checklist that I will confirm the name of the patient and site of the patient as well as the procedure of the patient asked. Then I will arrange the
Just
instruments.
imagine, yes, the lesion is on the thigh. Kindly tell me how would you prepare your area?
Yes,
Yes.
right. I will first of all I will gather all the instruments. Uh, I will gather
Yes.
instruments like first of all I will need the scalpel, 10
Yes.
number blade, 10 number
Okay.
blade and gloves and surgical gloves and sterile gown and drapes
Okay.
and then mask. And then I'll need needle holder with forceps
Yes.
and and suture material
Yes.
and then
Which
local
suture?
anesthesia.
Yes, please.
Uh, I'll use 20 or 30 nylon or
It's thigh, right? Okay. And
yeah, and then then I will ask for the local anesthesia. I will ask to check for the expiry date before using the anesthesia of
okay.
the local anesthesia. Then I will also require 10 cc syringe and then 21 gauze and 25 gauze needle and the dressings adhesive pads for the patient.
Okay. What would you do before
Then
you'll begin?
yes, then I will first of all explain. I will explain the
You've
procedure and
already
then
explained then.
keeping, yes, the area is cleaned with the betadine solution. And the first, and I'll ask the patient, do you have any, are you taking any blood thinners or are you allergic to any iodine or acetyl alcohol solution?
No.
So
Yeah.
then I will ask the chaperone to please help me in filling the syringe with local anesthesia. Then before using the anesthesia, I will check out for this expiry date. I will first of all uh, fill the syringe with the 21 gauze needle, and then I will discard this needle, and then I will use 25 gauze needle before inserting into a needle. I will ask the patient, I will say to this patient that I'm going to insert this and you will feel a sharp scratch. Then the whole area would be numb. Then I will aspirate and inject whether I'm not in to confirm that I'm not injecting into the vessel. Then I will instill the local anesthesia all around the nevus, that skin lesion. Then I will wait for the 5 minutes so that the effect of local anesthesia has arrived.
How
Then
would you make
uh,
sure that local anesthesia has started its effects?
yes, with the
Yes.
help of tooth
Very
forceps,
good.
I will pinch the skin and I'll ask the patient to feel any pain.
All right.
If there is no
Then,
pain, then it is numbed. And then I will start my procedure. First of all, I will use measurements. I will make an eye with a ratio 3:1 on the lateral
okay.
sides on the lateral sides, and then on the superior and below the 2 mm of distance is required. And then I will completely join all the measuring points in to making and in the result would be making an eye. Then in one go I will excise the whole lesion.
Good.
Then I will suture the wound with the 30 nylon or prolene suture, starting from the periphery and then going towards the center using interrupted suture.
Interrupted. Good. Yes. Why
Uh,
would you prefer
then
interrupted sutures?
I will use interrupted suture because if in case there is an infection in the wound and redness or any infection on the wound, then only that wound, that particular suture can be removed. If we use a continuous suture, the whole of the wound is open. If we need to remove the suture in future, if there is infection present in the wound.
Okay. Yes. Please continue. What would you do next?
Then I will first of all, then I will do the dressings of the patient. Then and then I will discard the sharps in the sharp bin and other in the waste bin, general waste bin, and then I will fill the histopathological form and document the finding, OT notes, and I will thank the patient and I will scrub my hands.
Okay. And what instructions
And I
would
will
you
give,
give to
yes,
the
I will give,
patient?
yes, then, yes, I will give instructions to the patient that in 10 days, approximately, yes, in 7 days, you will need dressings every alternate day, keeping the wound is clean, and you will be discharged with the simple analgesia. And if there is an increase in the redness or any swelling, pain, or any systemic symptoms like nausea, vomiting, fever, and it is a mal address discharge from the wound, you please report back to me or with the GP surgery, and then uh,
Okay.
and that right.
How should the incision be made?
It should be yes, the scalpel should be first of all handed just like a pencil, and then it is made uh, in elliptical fashion
Okay.
around the lesion.
Can you define Langerhans lines? What are they?
Yeah. These are the local topological collagen lines which are present in the dermis of the skin, and they help in they are present they represent the underlying muscle fibers and they help in wound healing with scar formation.
Okay. When exactly would the histology report be available?
This is generally a time of a 2 weeks frame.
If patient was allergic to what was the solution? If patient was allergic to a local anesthetic that you gave, how would you advise the patient that what should patient do?
First of all, I will discard that anesthesia and I will report uh, uh, this incident because of the allergy, and I will advise the patient to uh, can I answer this
Yes,
later?
we can later. Okay, good. Thank you.